Welcome back. Who would have thought the eye was such a complex little thing? I mean, so far with Tony we've talked about flashes, we've talked about floaters, we've talked about contacts and cataracts, we've talked about corrective eye surgery, all sorts of things. But today we're moving on and talking about the itchy scratchies.
Yeah.
Tony,
how you doing there?
welcome.
Good to see you.
Itchy, that's something off Itchy Scratchy show. The Simpsons, isn't it? Yes. Itchy Scratchy eyes. Nothing worse.
No, and we spend a lot of time talking to people about the comfort of their eyes. People come and see us, sure, because their eyes are blurry or they just want a routine check, but a significant proportion is uncomfortable eyes, just with a lot of the things that we do.
I mean, because when you think about it, and I'm not being silly here, but your eyes, you're using them all the time.
Absolutely.
Apart from when you're asleep at night.
Yes, yep. And so, that's an important part of your vision, but also, just your daily routine in terms, if you've got uncomfortable eyes, it can seriously get in the way.
So, I mean, what causes this? I mean, just some of the things we've got here. They get tired, they get sore, burny, itchy, gritty, red.
And sometimes even watery.
Yeah.
I know, and often it sounds strange when people have watery eyes, but often the underlying cause is actually people's eyes often get dry. And particularly when you're concentrating. So it's something we often see with computer users, people who work in air conditioning in an office, or even outdoors in the wind, and people also who are driving a lot. And the reason why, quite commonly, is two things. One is when we're concentrating, we tend to stare a lot more. And so if your blink rate is decreasing, your tears aren't being circulated around on the surface of your eye as well. And quite a number of people, their normal tear volume that they have in their eye is lower. In other words, so the normal layer of tears ends up being thinner and therefore is more susceptible to drying out, which can lead to a lot of the symptoms that you just mentioned.
So how does the tear thing work? I mean, how does the whole thing work?
Well, most of the tears are produced from glands in the eyelids, and also there's a gland up under the outer edge there that's called the lacrimal gland that produces most of the moisture. And there's three main layers. One, the base layer that's actually on the surface of your eye is actually a mucus layer that allows the tears to sort of adhere to the surface better, to stick to the surface. Then the bulk of it is just basically a salt water solution with some proteins in it to, again, lubricate the surface. And then there's a thin oil layer on the surface of that is there primarily to slow down the evaporation of the watery layer, if you like. And so you can imagine that a deficiency of any one of those three main components can lead to your eyes being, a little dry and uncomfortable, therefore, as a result.
So that's really interesting because so tears are not there simply for an emotional reaction when you're crying. No. They're there actually for a purpose.
Yeah, there's two types of tears. What we call your sort of basal or normal tears are basically just a thin layer that coats the surface all the time, and that's an important part of the optical aspects of your eye in terms of keeping it clear and smooth. And then when you cry, those are called reflex tears. So that's mostly the watery component of the three layers, and you just produce an excessive amount, as you said, in emotional situations.
Interesting, eh? It's really interesting. So how do we stop this happening? I mean, if we're getting dry eyes, the itchy scratchies,
yes.
What do we do?
Well, the main thing we want to do is we often start off with what we call sort of non-medicated treatments first, primarily because people want to avoid taking medication unnecessary and prefer to look at those options. So we talk to them about how the tear film is looking. And the main aim of trying to treat it early is you're going to stop it then also progressing to sort of more, not really bad things, but more uncomfortable issues like conjunctivitis, sort of more inflamed eyelids, and also it's quite common in allergic situations. People get hay fever and so on. Often the dry eye has an underlying cause. So we talk to them all about that to help people understand. And then the main treatment is just looking at using lubrication to begin with, which is basically artificial tears. And they're effectively a salt water solution with different degrees of a thickener added to help that lubricant stay in the eye for longer. And basically you can get sort of 3 or 4 levels from sort of quite thin and watery to quite thick and gooey, depending on how dry your eyes are. And then we also know that people have better things to do than put drops in their eyes all day. So then we encourage people usually to use the drops a little more than they feel they need to start with, and then work on the timing and frequency that suits them best. And typically, your eyes will get drier as the day goes on. So most commonly we'll get people to actually focus on the last 4 or 5 hours of the day. So maybe putting a drop round about dinner time and later in the evening if their eyes are tired or uncomfortable, and of course earlier if necessary. So, and one trick we've found with the lubricants, if you keep them cool in the fridge, a cooler drop.
Say, I mean, because I've used these before.
Yeah, we tried it, that's right.
And they were okay. I mean, they were doing their job. And then you mentioned put it in the fridge.
Yeah.
What a feeling.
Yeah, and you kind of expect it'll chill your eye, but it's actually much easier to tell when you've got it in, but it's also far more soothing and therefore more effective, and again, you don't need to use them as often.
And it wakes you up. It's like,
absolutely.
Oh, that's fantastic. This is absolutely great.
And people often have said that. You know, they were surprised that when their eyes were tired, it was kind of making them tired as well, so that often helps. So that's the first step. And, you know, the main thing is reassuring people there's no medication. So you can use the drops as much or as little as you like when using lubricants. And occasionally if people, you know, in a rare side issue is they have issues with the preservatives, so you can get preservative-free versions as well. Whereas with other medicated drops, you know, you've got to use them in a more regimented way and less frequently. So we'll get them into doing that first. And then also working a lot on the conditions. So you're looking at, for example, like airflow. So if you're in air conditioning or you have the aircon on in the car, trying to avoid having it blowing towards you wherever you can. You know, you can't sit there thinking about blinking more often, which is something that would circulate your tears around. You know, you've got better things to do, so that doesn't work. So yes, the lubricants, looking at the airflow, and then just generally looking at, you know, trying to give yourself some visual variety. For example, with computer users, you know, a lot of people are using the computer 6 or 8 hours a day and you know, are staring at the screen for, you know, non-stop. So we encourage people to have little breaks or maybe try and break up their visual tasks so they're getting some variety. You know, all those things definitely make a difference.
And we can get rid of the itchy scratchies.
Absolutely. So it keeps your eyes much more comfortable.
Thanks for your time, Tony.
No problems. You're welcome.
Some information again. After the break, we are catching up with Christine Findon from the Council. The Keep Rotorua Beautiful Awards have happened. We will have a chat about the Supreme Award winners, a little bit about the organisation that Christine works for as well with keeping Rotorua beautiful. That is next on City News.